Oh, sorry. Hello. Hi. My name is Amber. I'm a nurse practitioner student with South University. What's your name?
Kayla,
And what's your birthday?
11/08/1998.
Okay. Kayla, can you state the date for me?
It's June 11th, 2019.
Okay. Do you know where you're at?
I'm at the doctor's office,
Okay. And what brings you in today?
just an everyday checkup.
Okay, great. Today we're going to be doing a head-to-toe assessment on you.
Okay.
I'm going to wash my hands and we'll get started. Okay. So first we're just going to inspect Kayla's skin to make sure that there are no lesions, no nevi. Her skin is warm and dry and everything is intact. And I do not see any lesions anywhere. Okay. Next we will check the scalp for any lesions, any lumps, any tenderness.
No.
Okay. Kayla's head is normocephalic. Hair is evenly distributed and nice and clean. Next we will evaluate your cranial nerve 5, your trigeminal nerve.
Okay.
Get you to clench your jaws really tight. You feel your masseter muscles here. Okay, relax. And we'll do TMJ. Check. Open your mouth really wide and close. Open, close. No popping or clicking noted. Any pain with that?
No.
Okay. Next we will test sensation on the face. I'm going to get you to close your eyes. And you just tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay, very good. Next we will test for motor. This is cranial nerve 5, your cranial nerve 7, your facial nerve. I'm going to get you to puff out your cheeks. Very good. Get you to squint your eyes really tight, shut. Don't let me open them. Okay, very good. And let me see your teeth. Okay, great. Everything is symmetric. Very good. Okay. Next we will start with your eyes. Okay. We will assess Kayla's cranial nerve 2 by assessing her vision. So hold this in your left hand, cover your right eye, and read the smallest print that you can.
The numbers?
Yes.
937826.
Okay, now switch hands, cover the other eye, hold it with your right hand,
Okay.
and read it backwards.
628739.
Okay, very good. Kayla's eyesight is 20/20, and that's normal for 20-year-old. We forgot to mention that Kayla's vitals before she came in, they were normal. Her blood pressure was 98/64, her pulse was 72, respirations were 16, and her temp was 98.8. She is 5'2", she weighs 130 pounds with a BMI of 23.8, which is normal. Her O2 saturation was 99%. Okay, we will continue on with the eye assessment. We will get you to do a peripheral finger wiggle test.
Okay.
And this checks cranial nerve 3, your ocular. We will get you to cover your right eye. And with your left eye, look into this eye. Do not move your eye. And just let me know when you see my finger coming at you wiggling.
I see it. I see it. I see it.
Okay? We're going to switch sides. Okay? Same thing. Do not move your eye.
I see it. I see it. I see it.
Okay? Very good. Next we will test the cranial nerve 3, your ocular, your cranial nerve 4, your trochlear, and your cranial nerve 6, your abducens cranial nerve for extraocular movement. I'll get you to follow my finger. Do not move your head. Okay, gaze is symmetrical, there's no nystagmus noted. Next we will shine a light in your eyes. Kayla's pupils are about 4 millimeters, they're round, and they're symmetrical in both eyes. Eyelids are about 2 millimeters above the or below the iris, and the lower lid is about 1 millimeter below the lower part of the iris. Sclera are white. Just gonna touch your face here. Conjunctiva is pink with no discharge. I'm just gonna shine a light in your eyes. Now I'm going to get you to look at the tip of my pen.
Okay.
And look at the glove box. Tip of my pen, look at the glove box. Okay. Kayla has positive consensual direct and accommodation reaction in both eyes. Okay. Next, we will check for red reflex. You just stare at that glove box again. Just a little closer to you, I have to look inside your eye. Okay. Kayla has positive red reflex. Structures inside the eye are normal. Okay, next we will evaluate your ears. Okay. Inspecting Kayla's ears, there are no moles, no lesions, skin is intact bilaterally. There's no drainage noted from the external canals. We will test your hearing. So I'm going to get you to cover your right ear. Okay. And just repeat after me. 5, 4, 7.
5, 4, 7.
Okay.
9, 2, 3.
Okay, very good. We'll do the other side. 3, 5, 2.
3, 5, 2.
4, 7, 9.
4, 7, 9.
Okay. Hearing is good in both ears. Next, we will test the cranial nerve 8, the acoustic nerve, for lateralization of sound. We'll do the Rhine test and the Weber test. So this is a tuning fork. I'm just going to place it on the bony prominence behind your ear. You just let me know when you stop hearing the sound, and then I will wave it in front of your ear, and you just let me know when that stops. Okay.
Okay. I don't hear any longer. I don't hear any longer.
Okay. And do the other side.
I don't hear it. I don't hear it.
Okay. Kayla has normal hearing. According to the Rhine test, she has a 2-to-1 ratio of bone conduction is greater than air conduction. Next, we'll do the Weber test, and I'll just place this on your head, and you just let me know if you hear the sound better in your right ear, your left ear, or in both ears.
Okay. Better in the left.
Okay. All right. Next, we will look inside Kayla's ears. The external canals are clean and clear. Tympanic membrane has a light reflex at 4 o'clock. Around you. Right, external canal is clear. And tympanic membrane has a 7 o'clock light reflex. Next, we will evaluate your nose. I'm gonna get you to clamp one side, breathe in, breathe out, and do the other side. In and out. Any problems
No.
with that? Okay. Next, look in your nose. I'm sorry, this tickles. Alright. Turbinates are pink, moist, non-boggy, no drainage noted. Palpate your sinuses, just let me know if it's tender to touch. Any pain? Okay. Next we will evaluate your neck. We're going to test range of motion of the neck, so I'll get you to bend your head down, extend it back, bring your ear to your shoulder, the other side, and I'll have you rotate it from side to side. Okay, I'm going to have to let you do that against my hand. Head forward, head back, okay, head to the side, head to the side, rotate, turn your head the other way. There you go, and move this way. Okay, very good. Strength is 5 out of 5. We will palpate the lymph nodes. We have the occipital lymph nodes, post-arcular, periocular, tonsillar, submandibular, segmental, posterior cervical, superficial cervical. Okay. There are no noticeable lymph nodes that are swelling. Any tenderness with palpation. Okay. Next, we will evaluate the mouth. Just have to put some gloves on. Lips are intact. They're nice and moist and pink. Just get you to open your mouth. Buccal membrane is pink, moist. Say ah.
Ah.
All right. Uvula is midline. No exudate noted. No erythema noted. No swelling of the tonsils noted. The cranial nerve 9 and cranial nerve 10, the vagus nerve, as I said, the uvula was midline. We get you to stick out your tongue now. Okay, Kayla's tongue is symmetrical. There's no fasciculations. That evaluates the cranial nerve 12, the hypoglossal nerve. Okay. All right, now we're going to move on to your shoulders. Any tenderness at your clavicular point, acromial point, no tenderness. Okay. Breathe in. No supraclavicular lymph nodes. And now we'll test range of motion. Okay. We get you to bring your arms up, bring your arms down, bring them forward. And you extend them back. Okay. Any pain with that?
Okay.
Have you do that against my hands. Up, down, out, in. Okay. Kayla's strength is 5 out of 5. Assessing epitrochlear lymph node, none felt. None felt in the left arm. We'll palpate pulses, brachial pulse. It's 2+. Left brachial, 2+. Radials, 2+. Right radials, 2+. Cap refill is less than 2 seconds. No cyanosis noted in the fingertips. Okay. So we will feel the carotid pulse. It's 2+. plus. 2 plus. Okay. I'm gonna check your thyroid. Okay. Can you swallow? Very good. No nodules noted. Thyroid is normal size, symmetric on both sides. Next, we will listen for bruits in the carotid with the bell of the stethoscope. Take a deep breath in and hold it. Okay, breathe. Take a deep breath in, hold it. Okay, very good, breathe. No bruits noted. We now assess the pulse. Aortic area. S1, S2 noted. Pulmonic. S1, S2 noted. Tricuspid. S1, S2 noted. And mitral. S1, S2 noted. Rate is about 70. Rhythm is regular. Okay. Next, we will evaluate your anterior chest. Listen to your lung sounds. Deep breath in. Out. 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 Again. Lungs are clear to auscultation, no diminished lung sounds, no ablatation lung sounds noted. You okay?
I'm good.
Okay. Next, we will evaluate posterior chest. Any pain down the spinal cord?
No.
Spinal column? Sorry.
English.
No lymph nodes noted here. Okay. I'm just going to tap on your back, okay?
Right.
All right, lungs are resonant. Listen now. Deep breath in and out. In. Out. In. Out. In. Out. In. Just let me know if you have any pain with this. Checking CVA tenderness. Any pain?
No.
Okay. All right. Now we're going to get you to lie down. Okay.
All the way down.
Okay. Next, we're going to assess Kayla's stomach. I'm going to lift your shirt up.
Okay.
Okay. Kayla has normal contour to her belly. There's no scars noted, no bruising noted. Everything looks good. We will auscultate first for bowel sounds. Normoactive vowel sounds in all 4 quadrants. Next we will percuss. We have tympanic percussion over the quadrants of the abdomen. Next we will percuss for spleen. Identifiable spleen below the left costal margin. And now we will assess the liver. And no enlargement of the liver noted. You take a deep breath in and out. Okay. Just a little bit of palpation, light palpation first. Any tenderness with this?
No.
Okay, we'll be a little bit deeper this time. Just feeling for masses. There are no masses noted. Kayla's bladder is not distended. We'll percuss the bladder now. Tympanic sound noted. Okay. Just let me know if this hurts. We're going to do rebound tenderness. I'll push you in. Is it painful? Oh, we don't release. Okay, we'll do the other side. Is it painful?
No.
We release? Okay. Next we'll do the sew sign. You're going to bend your knee up and try to push my hand away with your thigh. There you go. Any pain in your belly?
No.
How about this side? Any pain in
No.
your belly? Okay, great. Alright, next we'll do the obturator sign. Hold your leg and turn your leg in. Any pain in your belly?
No.
Push against my hand that way. Any pain?
No.
Okay, we'll do the other side. Any pain in your belly?
No.
Push this way. Okay. Any pain?
No.
Okay, great. Next we'll listen for bruits for the abdominal aorta. And renal arteries. Iliac arteries. And femoral arteries. No bruits noted. Sorry. Next we will evaluate your hips. Ischial tuberosity, greater trochanter, any pain with that?
No.
Okay, alright. Now I'll have you sit up. I'm sorry, lay back down. I'm sorry.
It's an ad work for today.
Alright, we're going to test the range of motion of your hips. Can you bring
Okay.
your legs straight up? Alright, and back down. Can you bring it out? Okay. And in. Same thing with this one. Okay. And down. And out. Okay. And in. Very good. Can you do it against my hand? Alright, good. Good. Out. Good. In. Alright, we'll do the other side. Down. Out. And in. Okay. Strength is 5 out of 5 on both legs. And range of motion is good in the hips. Okay. Next we'll evaluate the knees. Okay. No swelling. She's ticklish. Any pain with that?
No.
Okay. Straighten your leg out. Yeah, you can do both at the same time. That's fine. And down. Okay. Turn your foot. Any pain with that?
No.
Any pain with that?
No.
Okay. Now we're going to do it against my hands.
Okay.
All right, and back. Okay. Check your ankles, your feet. Can you push up against my hand? Okay, point your toe down. Okay. Same thing on this side, up and down. Okay. Any pain in your ankles?
No.
No swelling noted.
No.
Dorsal pedis pulses are 2+. Posterior tibial pulses are 2+. Bilaterally. Popliteal pulse 2+. Bilaterally. Okay. Cat refill is less than 2 seconds on both sides. Okay. Next we will test your deep tendon reflexes.
Okay.
First we will do bicep. This tests C5, C6. Alright, relax your arm. Okay. Relax.
Mm-hmm.
Okay. Next we will do tricep. Relax, just let your arm hang in my hand. Okay. Same thing on this side. Relax. Okay. Now we'll do a brachial radial pulse. Reflex, sorry. Relax your hands.
Mm-hmm.
Okay, it has 2+ in bilateral arms, deep tendon reflexes. Okay, next we will test patellar.
Okay.
Just relax your leg, let it. Okay. Next we'll do Achilles. Relax your foot. Relax your foot. Okay. 2+ in both of those. Next, I'm just going to scratch the bottom of your foot. Okay. The Dansky is normal 2+. Okay. Next, we will. I'm going to get you to close your eyes.
Okay.
Okay. We're going to. I'm going to put something in your hand, and you tell me what it is. Okay.
Okay. Keys.
Okay. Very good. And I will put something in your other hand. This is stereogenesis to see.
Phone.
Okay. Make sure your proprioception is good. Okay. Next, I need you to take your heel,
Okay.
start at your ankle of your other leg, and run it up to your knee and back down. Okay. Can you do the other side? Very good. Okay. Next, rapid hand movement. Get you to place your palms on your hand, back out, as fast as you can. Okay, very good. Next, we'll do the dull and sharp touch like we did before. Close your eyes, please.
Dull. Dull. Sharp. Dull. Sharp. Sharp.
Okay, we'll do it on your legs too.
Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Okay, very good. Kayla has good sensation. Bilateral extremities. Next, we will test your spine range of motion. So I have to sit down.
Okay.
Okay. I get you to bend forward. Okay. And extend back. Stand up. And go back as far as you can. Okay. Very good. And now I'm going to get you to rotate your shoulders to turn your body. There. Mm-hmm. Very good. And go side to side as far as you can. Okay. Other way. All right. Very good. Range of motion is good. Now I'm going to get you to walk to the door normally. Okay. Have you turn around and walk on your toes. Okay. And now walk on your heels back to the door. Okay. Now can you place one foot in front of the other, heel to toe, without looking at your feet? Very good. Next, we will test your balance. I'm going to get you to hold your hands out, eyes closed. Turn your hands over. Okay. And we'll have you stand there. Kayla's balance is intact. for pronator drift. We'll push you, try not to fall down. Romper test is intact. Balance is good. This concludes our head to toe assessment. I will wash my hands now since we're done. Thank you for being my subject today.
Thank you.